Hi guys, and welcome to our second video on ECG. Today we will be talking about the fun parts of this topic, since we have already covered the basics in our first video, so make sure to check it out if you haven't already. The link to this video will be in the description down below. But without further ado, sit back, subscribe to our channel, and enjoy. Before you do anything fancy, as responsible physicians, you need to check the calibration of the machine. To do that, look at the rectangular wave on the left of the paper, which is known as the reference pulse. It should be 10 millimeters tall, which should cover 2 large boxes or 10 small squares. Since the paper speed is around 25 millimeters per second, a large box, which is 5 millimeters in length, corresponds to 0.2 seconds. Basics of ECG is as follows. The y-axis shows you the voltage in millivolts, or potential difference to those who are physically talented, and the x-axis shows you the time in seconds. You're now ready to do the hard stuff. Let's explore what the squiggly lines actually mean. The first tiny wave is known as the P wave, which is caused by the atrial depolarization. The second large spike is known as a QRS complex and is caused by ventricular depolarization. The last bump is known as a T wave, which is caused by ventricular repolarization. We usually look at the waves in segments or intervals as shown in the diagram. The PR interval is the distance between the start of the P wave to the start of the Q wave, which is normally 0.12 to 0.2 seconds. The QRS complex, as previously discussed, is normally less than 0.12 seconds. The QT interval is the distance between the start of the QRS complex to the end of the T wave, which is normally less than 0.44 seconds in men and 0.46 seconds in females. Deviation indicates pathology, such as bundle branch block. To review what bundle branch block is, feel free to check out our previous video. Next, we will be talking about abnormalities in the ST segment. It sounds a little bit odd to only focus on one segment like this, but trust me, you won't regret it. This is a very important segment to look at if you are presented with a critically ill person in the emergency room. The ST segment occurs between the end of the QRS complex and the start of the T wave. This segment should normally be an isoelectric line, and elevation or depression of this segment could indicate myocardial infarction or ischemia. Patients who show ST segment abnormalities during a myocardial infarction require immediate treatment, as this finding suggests they are having a major infarction. The lead in which the abnormality occurs can help clinicians work out in which artery the infarction is occurring. For example, anterior ST elevation signifies that the left anterior descending artery is occluded. In contrast, inferior ST elevation is a little bit harder to interpret, because in 80% of cases this signifies occlusion of the right coronary artery, but in 20% of cases this means that it is the circumflex artery that is occluded. A bradyarrhythmia is an abnormality of cardiac rhythm resulting in a heart rate below 60 beats per minute. The main bradyarrhythmia we'll be focusing on is heart block, of which there are 3 degrees, with the first degree being the least severe and the third degree being an emergency situation. First degree heart block is seen in children and athletes and is characterized by a constant PR interval above 0.2 seconds and a regular rhythm. However, it should not always be dismissed, as this arrhythmia can be caused by ischemic heart disease and conduction system disease. Second degree heart block is more complicated, as there are 2 types known as Mobitz 1 and Mobitz 2, where the latter is more serious. Mobitz 1 can be easily identified on an ECG, as it is characterized by a PR interval which increases in length, followed by a missing QRS complex. Similar to first-degree heart block, this rhythm is usually benign, unless associated with an underlying pathology such as myocardial infarction. Mobitz 2 is more serious and requires treatment with a pacemaker. It is characterized by an irregular rhythm where QRS complexes may be longer than 0.12 seconds, and non-conducted sinus impulses appear at irregular intervals. This condition is never benign and is associated with ischemic heart disease and fibrosis of the conduction system. Last, but definitely not least, third-degree heart block is characterized by the complete dissociation of the atria and ventricles. This may lead to loss of consciousness or angina, so needs to be treated with a pacemaker, and sometimes other interventions such as isoprenaline are required too. A little unrelated, but it is good to be aware that if a patient who is having an inferior myocardial infarction presents with this rhythm, that indicates a worse prognosis than usual. A tachyarrhythmia is an abnormality of cardiac rhythm resulting in a faster heart rate that is above 100 beats per minute. There are two types of tachyarrhythmias that we will be focusing on today, which are narrow complex tachycardia and broad complex tachycardia. Narrow complex tachycardia, as the name suggests, has an abnormally narrow QRS duration of fewer than 0.12 seconds. You can see either atrial fibrillation or flutter on the ECG. How do you tell these apart? Well, there are no P waves for atrial fibrillation, and there are a bunch of P waves in atrial flutter. You can also have broad complex tachycardia, which means, as you probably guessed, the QRS duration is greater than 0.12 seconds. You can see either ventricular tachycardia or ventricular fibrillation on the ECG. You can tell them apart by looking at the shapes. The waves look similar in ventricular tachycardia, but super random in ventricular fibrillation due to a lack of organized electrical activity. In either case, broad complex tachycardia is really dangerous as it signifies a problem with the ventricles, which are responsible for pumping blood around your body to support life. Thank you for watching this video. We hope you found it exciting, but not so exciting as to get your heart in a flutter. Please comment if you want to see similar content, and remember to like and subscribe to support our channel.